Hey guys, I'm updating because I am over 6 weeks post-op. I should have updated on like Friday, but I didn't get around to it, so I'm updating today. Anyway, yeah, so I guess I'm 6.5 weeks post-op at this point. I went to my orthodontist today, so I guess it was a good time to update. And it was a good appointment because I still had my surgical hooks on, I still had my surgical wires on, and I still had, there's like a metal wire wrapped around all the brackets instead of having elastics. So they had to take all of that off. They took off the arch wire and the hooks. They had to cut the arch wires because she couldn't get them out. I still have a lot of swelling, so it's really hard for them to get into the sides of my mouth to do adjustments. So the adjustment was really long, but I'm happy because I have like super thin wires now compared to what I had before, and I have elastics on again, so I don't have the wires, and I don't have hooks anymore. I have a couple makeshift hooks that they put on, but not like the big surgical hooks that I had everywhere. So, it's a good change. I noticed though, as you can see too probably, is that I'm swollen over here. I don't know if this has anything to do with the infection. Well, it probably does. But early on I had an infection on this side and I swelled up. So I'm still pretty swollen. I don't know if it's from all the movement today or what's going on, but the incision line, like I was saying before, is still really gross. It's still like really puffy and I don't know, it's still like kind of fleshy, like it's not pretty. So I don't know what's going on with that yet because I haven't seen the surgeon. I'm going to see him next week, so we'll see what he says. I think it's next week. I'll have to check. But yeah, so I had to have my mouth open for a really long time, so it's really tired and sore now. But my swelling is going down. I'll show my profile. I'm really happy with it. I really love the shape of my chin now. And I love the shape of my jaw. I can't wait for this to go down. But I'm really happy with all the changes. My face is still really stiff, as you can probably tell. I'm not talking completely normally. I have no feeling from the bottom lip down. So this whole region is still completely numb. Like I can poke it and I can't feel it, but I feel it in my teeth. My lip is really numb. It's really annoying, like when I'm eating or drinking. But I'm only 6 weeks post-op, so we'll see what happens as time goes by. It is a huge difference though from what I was like prior to surgery, so I'm really happy with it. I'm going away in like less than 2 weeks now, so I have my suitcase out and I'm starting to pack and get all of that stuff together. So I'm pretty excited. Hopefully during my trip I can eat easily. I'm still having a really hard time eating. I'm allowed to chew stuff, mainly like soft things, but I'm still pretty much cutting them all up and swallowing them because chewing is really, really hard. I have an extremely small range of motion, like I said before. I can only open my mouth this much. It's better than before, believe it or not, but not much better. It's maybe a couple millimeters larger, so it's not great, but it is good. And I feel like my voice is coming back to normal. Like, I don't sound as weird to myself as I used to. My hearing is still coming and going. For right now, I think it's okay, but like yesterday, this ear was gone. And what happens when my hearing goes in that ear, or either ear, is that everything I say sounds like a loud buzzing in my head, and even when I'm breathing, it's like, it sounds really loud, like I can hear it in my head, and it's really annoying. So I'm hoping that that goes away soon. That wasn't from the start. It started like later on, maybe like 2-3 weeks after surgery. My hearing started to really get funny. Other than that, I still have, like I said, I have the numbness in this area. I have some areas in my mouth that are numb, but it's really hard to pinpoint them because my mouth is still really swollen inside. The inside of my cheeks are still really swollen. I want to show you guys my bite. My bite is looking awesome. I'm still wearing the elastics the same. My orthodontist said to do them the same way my surgeon has asked. So it's like a box configuration, and what that's helping to do is bring my molars back together. Because when you have an anterior open bite and you have jaw surgery, you'll end up with, I guess it's a posterior open bite. I don't know for sure if I'm even saying that right. But your back teeth, your molars won't touch. So even though your front teeth are closing, your molars don't touch. It's like the opposite of what you go in with. But it's not that hard to fix. So they fix that with elastics, and yeah, then you have a decent bite. So my bite is closing really well, and my orthodontist said I won't be in braces for much longer. He said there's very little work he has to do, and he's going to leave it up to my surgeon to decide on how long I keep the braces on. So he said it could be 2 months, it could be 4 months, it could be 6 months. But he's emailed my surgeon and he's going to ask him how long he wants the braces on. So I'm going to ask him when I go next week to see what he says. And I'll let you guys know how long I'll be in these. Honest to God, though, I'm not really that like excited about getting them off because I want my face to heal before I get the braces off. I feel like if I got the braces off and I'm still waiting for swelling to go down and feeling to come back and my motion to come back to my face, I might be a little bit sad because it's not like the outcome that I want yet, because the recovery is pretty long. So I don't know, but I'll ask him and see what he says. It'll be nice to just have like a goal. I really can't wait for this to go down though. It's really annoying. Ugh. But yeah, that's the thing with the surgery too, is your swelling will come and go. Like I'm 6 weeks post-op, and like some days I wake up and I'm swollen again. Some days I'm really swollen under here, and some days it's in the cheeks. So it kind of comes and goes. It's still going around the chin too. My surgeon said wherever they cut the jaw is where you'll have, I guess, the most residual swelling. So I've had my jaw cut. I had the top jaw cut across. I had the bottom jaw cut along here. That's why I'm swollen down here. And I had my chin cut. So in those areas, like here and here, the swelling is going to take a while to go away. But it's going away nice and slowly, and before I know it, I'll be, back to normal. But yeah, I will update next week. Probably, if I don't update for my 7-week point, I will update after I see my surgeon and before I go away, for sure. And yeah, I'll let you guys know how everything's going. And thanks for watching.